Hi, everyone. Welcome to session 1 of Trauma-Informed Breastfeeding. This session will run from 9 a.m. to 11 a.m. We do have simultaneous interpretation provided, so please navigate to the bottom of your screen and click on the globe that says interpretation and select either English or Spanish. You have to select at least one option. Also, please keep your microphones on mute unless you're facilitating or asking a question. I will be monitoring the chat, and the facilitators will be using a system to take questions. So feel free to type your questions in chat, and there will definitely be time to answer them. Lastly, I'm going to drop an electronic signature sheet into the chat, and it's required for you to enter your first and last name. And then if you're an RN and would like continuing education units, please also enter your title, your RN license number, and your electronic signature. And to receive the CEUs, you have to attend this full session, the session 2, which is on December 4th, and complete a short eval at the end of session 2. So I'm going to put the sign-in sheet in the chat right now. It's very quick. Again, please make sure you sign that. And I see a few more people joined, so I want to make sure everybody heard the part about there being interpretation. Please navigate to the globe at the bottom of your screen and select either English or Spanish. Okay, and then lastly, before we start, I want to say a big thank you to Adrienne Markworth, longtime COI partner and healthcare workgroup member. She's also the CEO and founder of Leah's Pantry, which is the organization who designed this training and whose staff are facilitating this training. So I just want to say thank you very much to you guys for being here today. And then I'm going to go ahead and pass it off to Crystal Bown to do introductions.
Okay, good morning, and thanks so much for joining us for Trauma-Informed Nutrition Security. This is the first session of a two-part series, as was mentioned. I am Crystal Bown, and I'm joined by Carrie Richardson, and we'd like to thank the San Diego County Childhood Obesity Initiative for inviting us and partnering with us to provide these two sessions. So now I'm going to let Carrie tell you a little bit about Leah's Pantry. Carrie?
Yeah. So at Leah's Pantry, we envision communities where everyone can cultivate a healthy relationship with food and their bodies. Our mission is to build and implement community nutrition food security programs that align with trauma-informed, resilience-focused principles. So we do a lot of capacity building trainings like this, which is in the middle of what we do, the middle column here. So capacity building with partners such as yourselves or partners who work in food security or food banks, just to help build the understanding of what is a trauma-informed approach, and more specifically, what does that approach look like when we're talking about nutrition and health and wellness. Next slide. So we will be feel free to use the chat. If you have not been on Zoom for a while, they've got all sorts of upgraded chat features, emojis. You can reply directly to folks. We will also use Mentimeter. If you have not used it before, it's pretty easy to use and we will walk you through it, but it's a great way to kind of collect everyone's voices and input into one place, where you're not kind of having to, keep up with the chat. And then, as was already mentioned, today's session is being recorded. All right, so we always like to do a little bit of attunement, especially, those of you who are maybe coming off of a 3-day weekend, 9 a.m. So we want to just check in and have you all check in with yourselves. So with a little humor, what's your sheep number today? If you want to share, feel free. But also, this is really for yourself to check in. How are you feeling? Where are you coming from? we've got a 1. Yeah, that's a good 9 a.m. on a Tuesday/Monday. Feeling silly, some 5s, some 4s. So we're kind of all over. We got a little bit of everything. Excuse me. So take this moment, take a big breath in, big breath out, and whatever else is going on right now, work or otherwise, try to make a commitment to yourself to put that on the back burner for 2 hours and kind of stay present with us while we go through this training. All right. So this is a two-part series. So today will be a lot of definitions and background, and the next session in December will get into what a trauma-informed response may look like. And we're going to use this 5 R's framework that will kind of break down with each step of the process. So today by the end of today's session, we hope you will be able to define and describe what trauma-informed nutrition security is. We hope you will be able to realize and recognize that positive and adverse experiences shape our relationship to food, our bodies, and ourselves, and that you will be able to discuss the impact of adverse experiences and trauma during pregnancy, childbirth, and the postpartum period. So those are our objectives for today. We're going to take a moment to introduce ourselves. So, Crystal.
Hello. So again, I am Crystal Bound. I am a training manager at Leah's Pantry. I have a background in public health and health coaching, and I've worked with individuals and communities on various nutrition and built environment initiatives. So community gardens, food distributions, nutrition classes, walkability and movability projects. I live in Little Rock, Arkansas, actually, with my husband. And in our free time, we love to travel, hike. And as you can see on the slide in the top left-hand corner, we really like to visit independent bookstores wherever we go. Carrie?
My name's Carrie Richardson. I am located here with you all in San Diego. These are some pictures of my husband and my daughter, who is actually 4.5 now, so a bit older than these photos. She's a little COVID baby. She was born about 2 weeks after the shutdown, so we had quite an experience with our first child. From a professional standpoint, I do a lot of the same work that Crystal does. From a personal standpoint, with this topic specifically, I've had my own breastfeeding journey with my daughter. And we really had what might be termed a successful or best case scenario, right? And as we'll talk about later on in this presentation, even when it goes well, and she actually breastfed until she was almost 3, which, has its own challenges, but even in those scenarios, it's still difficult no matter how you slice it. So we were fortunate to have really good care, even though it was a challenging time for healthcare as a whole. Great lactation consultants that identified a tongue tie right away, right? Which if that had not had been identified, then we certainly would not have been able to do what we did. So, really in this stage of life personally, where I'm seeing lots of friends and family go through their own journey of feeding littles and seeing how diverse these experiences are, how diverse the healthcare is that they receive and the information that they receive, and really seeing this from a personal perspective as well. So with that, we like to start all of our trainings with kind of a level setting expectation that if you have never taken a trauma-informed training or done some capacity building in this area, set your expectations accordingly, right? It is a journey. It is not a checklist. So at the end of this training and after the end of part 2 of this training, you're not going to have everything that you need to take a trauma-informed approach to your work. And in fact, you may have more questions than you have answers, right? because this is a big topic. It is not something that you can boil down to, okay, here are the 10 or the 5 things that I need to do. It's really more of a journey than that. So be prepared to be open to new ideas and to do some self-reflection. And this is something that will take some time to kind of percolate in your brain over time. So we hope to start this journey, and some of you may be at different points in your journey as well. So we hope to go on this journey with you. So with that, we are going to do our first Mentimeter. So you can go to Menti if you want to access this on your phone. You can scan the QR code. If you prefer to type on your computer and you can manage 2 different tabs, then you can click on the link that Crystal just dropped in the chat, or go to menti.com and type in this code. And when you get there, you should have your first question. How is your work connected to breast and chest feeding? And so we're going to use this time just to get to know you all a little bit and to kind of ground our presentation and get to know everyone in the room, as well as you all getting to know each other. So we have someone who is a volunteer doula and interested in postpartum work. So certainly some direct lactation care involved there. Work on a grant to promote and support breastfeeding. Great. And if anyone is needing technical support, just drop that in the chat. Or you can come off of mute. We're going to be using Mentimeter throughout this presentation. So it'd be a good thing to get comfortable with. And once you have it opened, then you won't need to open it again. As we advance to the next question, your screen will advance. So just leave it open. So breastfeeding is the first food system encountered, and it's closely tied to childhood obesity outcomes later in life. Great. I'm a birth and postpartum doula, providing support to families and training to be a childbirth educator. Family physician, provide maternity care in the hospital, and director of residency training. Get 1 or 2 more responses, and we'll go to the next question. So seems like we have some folks kind of directly working with new moms and some folks working maybe further up or further down the line. As an advocate of food justice, proper nutrition and health is important. A WIC lactation consultant working with community partners to help create a more breastfeeding-friendly society. Great. And a volunteer birth doula wanting to better help and support breast and chest feeding after birth, I assume. Great. Okay. Thank you for sharing that. That really helps us as facilitators. So next question, what amazes you about the moms and people you work with? Part of a trauma-informed approach is to recognize and appreciate the strength and to be able to take a strength-based approach to your work. And so we want to really acknowledge what we see as strengths with the moms who you have interaction with. Some of you have direct interaction, some of you don't. But what amazes you about their ability to take care of themselves, take care of their families? Give a moment for folks to type it out. Resourcefulness, strength, resilience, and willingness to do the best they can. Perseverance and flexibility of people who encounter challenges with baby feeding. Yeah, there's a lot, like I kind of alluded to earlier, even in like a best case scenario, there's still so many challenges. I mean, just the challenge of like the number of hours and commitment and time and lack of sleep that just like to meet the baseline that it requires, it is not an easy thing. Determination to do the best they can for their family. Love and care for their family is awesome. Okay. Great. So that being said, it is also okay to acknowledge things that we may find frustrating or challenging. And throughout our time today, and especially in our second session, we'll give some tools to help kind of reframe and better understand these challenges. Our goal would be to approach these with compassion and understanding, and kind of explore them a little bit. But it still happens. So what comments or behaviors related to breast or chest feeding do you find frustrating or challenging? And these could be from moms or parents or families that you work with. It could be from, society as a whole.
And he's just there actually. And he was there last night. I was sending another picture. And so he sent me a couple of pictures. He said he was in a hotel in Budapest. So that's Gulyás.
Oh, okay.
But mine was a little better, I guess.
There we go. She's muted.
Okay, sorry. I was like, oh, are we sharing? All right. So what are some comments or behaviors that you find frustrating or challenging? This could be from professional or personal experience. The family member is not supportive of breastfeeding. Oh, right. I didn't breastfeed you and you turned out fine, right? The ultimate justification. Oh, we didn't keep you in car seats. You guys turned out fine. All sorts of things that we can justify with that statement. There's a lot of judgment about whether to breastfeed and for how long. A lot of guilt for moms making that decision. Yeah. As a mom, it feels as though you can't make a right decision, that there's always going to be someone has something to say. The internet always has something to say, no matter what you do. Lack of support for breastfeeding is so disappointing. Yeah, I'll say in those first days in the hospital, it is the differences comparing notes with other new moms. It is amazing, the differences of experiences. And I have a physician friend who's worked at different hospitals, and the hospitals will have different policies. And some are really pushing formula right from the beginning, which is interesting. My close friend did not receive quite the care that she perhaps needed in the hospital, and as a result, I had slight challenges, was sent home with a hospital grade pump, given great instructions of how to keep the supply up before my daughter could really get her latch in. And my sister had a similar experience, but didn't have, or similar challenges, but didn't get a hospital grade pump, didn't get any instructions about pumping, and supply took a downward trend because of that. So that support in those first days is really, really important, both from medical providers and from family. I can't do this anymore. I was not breastfed and I'm okay, right? That same justification as in our first comment. The expectation that breastfeeding comes natural and is easy. Yes, because it's natural, it must be easy. This is how humans have survived forever. Absolutely does not mean that there's anything easy about it. Like I said, even in the best case scenario, it is a very difficult time. Beautiful, but difficult. Not enough of a focus amongst professionals. And Crystal, could you scroll down just a little bit to see that whole comment? Not enough of a focus amongst professionals on being trauma-informed or practice consent. Can't read the rest of that, Crystal. Lack of support. Yeah, well, I think this comment's getting to some things we're going to talk about later on in the presentation. People blaming themselves rather than understanding that there's a lot of information and lack of support in society. Yeah, I'll say when my good friend ultimately had to kind of give up on breastfeeding because her supply was not enough and the baby was not gaining weight, and it was becoming kind of dangerous, and she wanted so badly to do it and was doing all of the things to try to make that happen. And that was so difficult for her to walk away from that. But ultimately was the best thing for the family, right? And for the baby. One mom had her breast removed because of cancer, and it was on her chart. She felt sad that the nurse made comments on her needing to try to breastfeed, right? And that, and the nurse has her chart. What does that mom feel, and what comments does she receive when she is out in public? And they don't have her chart, and they don't know. And still, there's assumptions and comments made, right? So there's so much complication and so much so it can be a very difficult thing for a lot of different reasons we see just reflected in these comments alone. Okay. That's all of our Mentimeter for just this moment. Excuse me. So we're going to go back to our slides. Give us another slide advancement, Crystal. So thank you for going through that Mentimeter. I think that's a good introduction to the topic, and good to know who we have in the room and kind of the varying perspectives that you all are bringing to this. So we're going to take a moment to talk about food. It's a fun topic, right? So we're just going to talk about the role of food in our lives, because in a trauma-informed approach, we start with ourselves. And this is a kind of a theme that you will see. And you know what, Crystal, sorry, I'm going to take over this one moment to switch. Oh, okay. So if we're talking about food or anything, with a little humor, you may have seen this before. I'm in a relationship with food and it is complicated. So regardless of if you have adverse experiences or trauma in your background, your relationship with food may still be a complicated one. And why are we going to start with ourselves? Well, we're going to start with ourselves because it's important to, if you're trying to take a trauma-informed approach, to be a little self-aware so that you can come in as your authentic self. You need to be regulated, you need to be attuned, because if you are not, then it will be very difficult for you to connect with others, to have a compassionate and understanding relationship with those you work with. And from there, compassionate relationships, then we can expand out to healing communities to make the impact and changes that we want to see in the communities where we work. But all of this starts with an understanding, an authentic understanding of yourself. So this is what we call, excuse me, the meaning of food in life. And there was a researcher, Naomi Arbit, who did research around the meaning of food in life. She was a Columbia University researcher, and she was intrigued about the association between health indicators and how people relate to food across cultures. So she created this meaning of food in life questionnaire. And this is just kind of summarizing the domains. We're going to go into the questions in a moment. And it's a validated construct for assessing how people are deciding what to eat, how they make decisions around food, and what is meaningful to them around food. And so the primary domains here are the 5 that you see on the screen. So starting on the bottom left, aesthetic is a meal can be a work of art. Social, food connects me with my culture and community. Health, nourishing my body and mind matters. Sacred, food connects me to a greater entity. And moral, I care about the impact of my food choices on the world. So without taking the full questionnaire, just seeing that you probably have, are more drawn to some statements over others. And this is not, you could be drawn to all 5 equally, right? It's not like only one or a ranking. But the research that she did was very interesting. And it found that health-conscious behaviors are more strongly predicted by the social and moral meanings of food rather than the health meaning of food, which is a bit counterintuitive, right? You would think that those individuals who really value the health domain of food, that they would have the greatest health behaviors. But that's not what her research found. The findings also consistent with research that shows that people make inferences about the moral qualities of themselves and others based on the food they consume. So whether that's a good reason or not, that moral was associated with these health behaviors, that was, that research is kind of tied together. So when it comes to eating behaviors, the meaning that people attribute to food, and in particular, how it relates to how we see ourselves in relationship to others, it appears to be even more important than actually just food-related goals and behaviors. So, we work with a lot of nutrition educators, or as a physician, you may set out to have maybe a SMART goal around health and nutrition. But actually understanding and digging into this relationship with food was more had better outcomes when it comes to health behaviors than taking this goal approach. So we're going to go back to Mentimeter and have you all just take a couple minutes to explore the meaning of food in your own lives. Because again, it's important to understand this for yourself before you can start to kind of ripple out and understand it perhaps for the individuals with whom you work. So we will go back to Mentimeter. Oh, here we go. And to the next slide. Okay. Crystal, can you give me a thumbs up that you're seeing the Mentimeter? Yep. Okay. So we're going to give you a chance to answer a couple of the questions under the moral domain and just kind of get a sense for where we are in the room. The first is, my food choices are an important way that I can affect the world. Second is, when I eat food, I think about where it came from. And the third is, my food choices reflect my connection to nature. Now, remember, there's no right or wrong answer, right? Okay, got a couple answers coming in. And so these slides are pretty cool that they show the distribution in the back, so you can see the average of the group, but you can also kind of see the spread. So I think we started off with a couple folks very, very strong in this domain, and now we have some mixed responses, pulling down the average a little bit. But overall, it looks like this is something that this group, or at least the 9 so far who have replied, think about. But that first one, my food choices are an important way that we can affect the world. I see a couple of you definitely responded with 1s or 2s. And so we can see just with the 9 folks who responded to this, the variety of how you see this and how you see your relationship with food. So what are some examples from your life that influenced how you answered those questions, just about the moral domain? What are some things that came to mind that made you click the 5 or the 3 or the 2? I can say personally, before I had my daughter, I was pretty high on all of these. And then, change in life and the change of the amount of time that I have to save all of the stems and compost, or create my own vegetable stock from my food waste items, and have this very labor intensive way of shopping to reduce the amount of packaging. And that kind of went out the door when my time became much more limited. And it's something that I would still aspire to, but I feel a tension here personally of, this is something that I would like to have be higher in my life as a higher priority, but other things have kind of taken that over. And so that's part of this reality of your relationship with food too. Sometimes there can be tensions within yourself. There can be tensions within your household. Maybe this is something you value, but others you live with don't as much. Or maybe it's something you've never even really considered. So our first respondent said, I don't eat processed food. I mostly cook at home and make sure my family has balanced diet. That includes my pets. We use imperfect food delivery to reduce packaging and throw food away. Yes, I use imperfect food as well. And I have to say, it took a pause again when my daughter was born because I kept forgetting to go in and say what I did or didn't need. And then I was almost wasting more because I was getting things that I wasn't able to use. I buy rescued fruits and vegetables. That's similar to the imperfect food. Composting, agriculture, nutrition. The more I have learned about our food system, the more I change how I eat, right? So hearing from some of the folks who probably responded a little bit higher on this. So next is social. So what about these statements? Where do they rank for you? Food is closely tied to my relationship with others. When I eat, I feel connected to the people I'm eating with. Sharing food with others makes me feel closer to them. Making food for others is the main way I show care for them. And food is a way for me to connect with my cultural traditions. Okay. Got some responses coming in here. And again, we see the diversity, right? Even in this small group. And even within statements that are all in the same domain. Some statements are stronger than others. So making food for others is the main way I show care for them. In yellow is a full point higher than food is closely tied to my relationship with others, as well as food is a way for me to connect with my cultural traditions. So we see some variety here. So again, what were some things that came to mind for you? I'll say for me, when I went through and answered this, I immediately thought of my growing up and my parents very much, food was kind of centered, a big family meal. I have two sisters, a brother, so a lot of kids. And especially when I hit that high school stage of all of the extracurriculars and you're never making it home for dinner, right? But there was always a really beautiful plated food with the saran wrap over saved for me. And then someone would sit with me and eat when I get home late and, had missed the family meal. Or my dad would we were coffee drinkers. And so even in high school, for better or for worse, but he'd make me this, a beautiful cappuccino in the mornings while I was, rushing off to my morning lifeguard job. So this was always a way, we weren't a gift family, right? But we were a let me make you a meal family. And that very much influenced how I show that I care for the people in my life. Stage of life, when my kids were young, family meals were a priority. Now, with more of an empty nest, meal times have changed. Yes, it is very different when you're preparing a meal for one or two versus a much larger group. I like to bake healthy treats for families and coworkers, right? And so, I'll say kind of embedded in that comment is some tension that we often hear from people when, we've done a lot of this. We do it at every training. We often hear this tension between the social and the health domain. And, we're training people who are generally working in public health in some way. So we usually hear this tension that people may feel about those two. Sharing food with others, feeding the homeless and the hungry. I like to make the cookies and sweets that I grew up with for others. Sharing food and fellowship is a major human connection. We do entertain our friends a lot, and I also cooked for 100 unhoused people regularly in an industrial kitchen. Wow, that is a lot of people to feed. We all have to eat. It's important for connection to share meals together, My partner's love language is baked goods. Well, that sounds wonderful. Kelly, would you like to share? Or that was an accidental unmuting.
Oh, that was an accident. Sorry about that.
Well, I didn't say earlier, but please feel free to unmute as well. Sometimes it can be hard to type in everything we want to say. Okay. And then finally, for health, and we'll go through this one a little quicker. Get satisfaction from knowing that the food I eat is good for my health. Eating foods that I know are good for my body brings me comfort. I feel nourished. I feel that nourishing my body is a meaningful activity. I eat in a way that expresses care for my body. So again, seeing some differences here. One thing I always like to point out is we oftentimes see a difference between the first and last. So the first question, I get satisfaction from knowing that the food I eat is good for my health. That's often higher than the last one that says I eat in a way that expresses care for my body. So sometimes, and you'll see this in some of the other domains too, you have these two statements, and one is kind of aspirational of like, I care about this, I value this. And the other one is I do it. And we can see here that there's, a little bit of tension just looking at that 1 point difference on average of I value this, but it's not always something that I'm able to attain. And we see that consistently across all groups. We've done this thousands of times. So same thing, what are some examples from your life which influence how you answered these questions? I typically choose healthy foods, but don't always eat them mindfully. Oh, I hear you. I've gone through ups and downs of trying so hard to eat mindfully, and I'm that person who's always eating too fast, and yeah, it's difficult. I wanted to lose some excess weight from the pandemic. I used Noom and was very successful with it, and that is supporting all of the features from the last question. I do want to be healthy, but also enjoy comfort foods in certain moods, and those aren't always healthy. As I get older, I see how the way I treat my body, feed it, exercise it, influences how I feel. Absolutely. And I'll say too that this is, that last comment kind of alluded to like changes, right? These may change over time. And this is another instance for me as a, relatively new mom where this was something that was ranked much higher for me ironically, before having a kid, right? And I thought I would be the mom who's like all homemade and like zero, no organic this, no GMOs, like really intense on what I would consider that this health domain side. And just the realities of everything, especially a kid during the pandemic. I mean, it really there's some tension there for myself, and there's some kind of readjusting of what I'm able to actually do. How do I make food for my daughter when she gets home from school, pick her up and it's 5:30, 5:45, and I've got exactly 5 minutes before she absolutely loses it that I have to feed her. You have to like get food in her now, right? So that really changes how I started to prepare meals. When it was just myself and my husband and we could eat whenever and no one's having a meltdown, it was a little different. So my nutritionist has helped teach me what my body needs, and I feel so good being in obedience to those things. The quality of food I eat is very important to me, but I'm in a stage of life where time and finances are limited, so my food doesn't align with my values. Thank you so much. So I think that, we can see from yourselves, and, we had what, maybe 10, 15 people answering that. And you guys are all in like kind of mostly in similar work and professional fields, how much diversity and how much tension you can even see just within the small group. So having some self-reflection and seeing how these concepts play out for you is a really important first step to then be able to take that next step in this empathetic understanding to imagine how this may play out for all of the people who you come into contact with, all of the moms or people or groups that support moms. So, and I think some of you may have learned something from had a different perspective that you saw from someone else who shared that. And I really will say that in that new mom stage of life, like things change, and there's so many other priorities, and how many times new moms are told, oh, just take care of yourself first. That's really important. But the reality is that like a new infant can't take care of themselves. So for me personally, this relationship with food really changed in those first weeks and months because there's just kind of a, feels like a time scarcity. So, in summary, improving nutritional health requires an exploration of the varied dimensions of food in our lives. And it's important that when we are talking about food with anyone, that we are able to have this holistic understanding. And you need to understand that they have this complex holistic relationship with food just as you do. And so if we only speak about food through that health domain, not only does research show that that's not the most effective way to get to health behavior changes, but it's just completely ignoring this like very complex relationship that we all have to food. So it's a good thing to keep in mind. So now we're going to shift gears, and Crystal's going to talk about a framework for a trauma-informed approach to breastfeeding. So kind of moving away from our relationship with food and moving into what do we mean by a trauma-informed approach and how does that apply to breastfeeding? So I will hand that over to you, Crystal.
Thanks, Carrie. Okay, so Carrie set me up well, so I'll just move forward. So we like to start by kind of asking the question, what is the difference between trauma-specific services versus a trauma-informed approach? And so that's kind of rhetorical, but you can think about that for a second. Trauma-specific services are evidence-based and promising prevention, intervention, or treatment services that address symptoms of traumatic stress and related challenges that developed during or after trauma. And I know that people here today, some of you may actually be touching on this. This is like counseling, people who have really been trained to provide that kind of support for people. But this is not what we're going to be talking about with trauma-informed care or a trauma-informed approach. What we're going to be focusing on is trauma-informed care. So this is a universal approach to addressing trauma and promoting resilience through policies, procedures, practices, and programs that are really adopted by all parts of the system or organization for all people receiving services. So it's when every part of the system is assessed and potentially modified to include a basic understanding of how trauma or an adversity impacts the life of an individual who is seeking services. And we do believe that everyone can do this. It's again, a comprehensive model. So we like to compare trauma-informed care to the curb cut effect. This was a concept that was coined by policy expert Angela Blackwell. And the curb cut effect describes how addressing and making accommodations for the disadvantages or exclusions experienced by one group of people actually creates an environment that benefits everyone. So as this graphic shows us, curb cuts or sidewalk ramps, they're really designed for wheelchair users, but it also benefits people who are pushing strollers or riding bicycles or wheeling luggage, and even people who are walking and running. So it really helps everybody. So similarly, implementing a trauma-informed approach can mitigate the effects of adversity and trauma, but it also has ripple effects that promotes safe and supportive environments for everybody. So every patient, every client, every program participant, and also staff. So we refer to this as universal trauma precautions. And this just involves small changes to a practice or a program or an organization that can be employed with everybody. And again, they do not require that providers know whether or not a specific individual has a trauma history. The point of universal trauma precautions is to minimize distress and maximize autonomy for all people. Excuse me. So why is understanding adverse experiences and trauma important for lactation care or people providing services for individuals who are breastfeeding, new moms, etc.? Well, what we're going to be exploring throughout this series is a woman or adult-centered approach and ways to develop some of these universal precautions that I just mentioned. So throughout both trainings today and on December 4th, we're going to provide a context for realizing and understanding adversity and trauma, as well as the benefits of positive experiences. We're going to discuss the importance of realizing and recognizing strengths and opportunities for healing, and we will provide some actionable steps for incorporating trauma-informed principles into your work. And that part's really going to come during the December 4th session. So it's also important, today is going to be heavy into adversity and trauma. And so we want to point out that it is important to understand how positive experiences can promote healing and resilience. We'll lean more into that on December 4th. But for example, research shows that some individuals with adverse childhood experiences, or ACEs, report breastfeeding or chest feeding as a healing and empowering experience because they're able to change the narrative about their bodies. They appreciated that bonding experience, and it made them feel like really like good caregivers. Research also shows that the best goal for a baby's health and life outcomes is the empowerment of the mom or the person who just gave birth so that they can resist shaming and trauma. It gives those individuals the skills to more confidently navigate their lives as a caregiver or mother and the tricky choices they have to make about so many things beyond what the baby eats. So Carrie mentioned this earlier, and this is that framework that we were building up to. This is what we refer to as the 5 R's. It's a diagram that shows the common steps of a trauma-informed approach. These steps were initially created by the Substance Abuse and Mental Health Services Administration, which is often called SAMHSA. We love acronyms, of course. And then it was elaborated upon by other folks in trauma-informed care work, and including Leah's Pantry. So we're going to look at those steps. So first we have realize the impact of adversity and positive experiences, recognize the signs of trauma and resilience, respond with trauma-informed practices, policies, and procedures. And again, we'll get more into the response during December 4th session. Resist re-traumatizing and be prepared to repair. And then resilience. Prevention and healing happens with support and care. So we're going to this will be our guide throughout the rest of the session and then December 4th, and we'll come back to it throughout. So you may have heard this quote before: seek first to understand, then to be understood. And that's really what we're going to be talking about today with a trauma-informed approach. So it's important to realize and recognize adversity and trauma and then its signs and symptoms so that we can respond with empathy and compassion. And I will turn it back over to Carrie.
Okay. So we're going to go through a definition heavy section, and then we're going to take a little break, and then Crystal's going to apply all of the definitions and background that we learn in this section specifically to the population of new moms. So we've been calling this trauma-informed nutrition security, right? We have a lot of word salads in the work that we do. So let's kind of like break down this word salad just a little bit.
Carrie,
So first,
do you share or do you want me to share? I think I'm still sharing.
I'm sharing. You were never sharing.
I was sharing, yeah.
Oh, okay.
Now you are. Okay.
Oh, interesting.
I think Zoom's doing some very odd things today. So
okay. Well, I was advancing your slides. I thought I was. Okay, but so we can see now?
It looks great on our.
Okay, good.
you did a great job advancing my slides.
Sorry. Okay, so first definition, and this one I expect is probably a more familiar one, but we'll break it down just in case, is the difference between nutrition security and food security. So food security is looking at having consistent access to enough food and time to support an active, healthy lifestyle, whereas nutrition security is having consistent access, availability, and affordability of food and beverages that promote well-being, prevent disease, and if needed, treat disease. So there's a bit of a nuance there, right? Food security may say that we're trying to kind of fill empty bellies, right? And nutrition security is really looking at the quality of what we're filling it with, but also access, availability, affordability. And it's also taking into consideration what are the foods that you want, right? What is the meaning of food in your life? It's not just any food is good enough, but there's a judgment and preference is included in that. So then we layer on trauma-informed nutrition security. So Crystal just gave a great overview of what a trauma-informed approach is, and we're going to dive into a little bit deeper into these and into some definitions as well. But she said that it's this universal approach, right? We don't need to know whether or not you've had trauma in your background. We are not diagnosing, but it's just saying that, you know what, this curb cut, it's good for everyone. So this approach, this empathetic, compassionate approach to food and to nutrition is good for everyone. And it acknowledges, it realizes and recognizes the impact of trauma and toxic stress on health and well-being. And it's supporting individual and community resilience. So how we do that, is another question, and we'll start to build into that. But sticking along this line of definitions and kind of level setting everyone's understanding, I want to dive a little bit into what we mean when we say trauma or adverse experiences, because these are terms that are kind of getting thrown around a little bit, right? So let's define these exactly. So what is trauma? Well, trauma is three things, the three E's. There is the actual event, but it's not just the event alone. And I think that this is where there is often a misunderstanding about what trauma is. Something may happen and someone may say, wow, that was traumatic. I have trauma from this event. But the reality is that it is not the event alone. It's not one big bad thing. And it's not even one tiny little things that add up over time, right? There's also these two other E's. So there is how you experience the event. And how a person experiences an event, there's a lot of things that dictate that. So there's your biology, right? There's just how your body experiences, and then there's also, do you have supporting support around you? How much resilience have you built up in your life? You may take the example of two kids in a family, and something happens in the family. Perhaps the parents go through a rough divorce, or a parent is incarcerated. And so the two kids experience the same event. One kid may end up with the lasting effect of trauma, and one may not. And that may be dictated by differences in biology. It may be dictated by differences in support. Perhaps one has really close relationships with their friends, or a really supportive coach or teacher, and the other one has nothing, right? And so you can see where this one event may result for one in trauma and lasting biological effects, and one may not. So it's important to consider all of those things. Now, like Crystal said, we're going to be a little heavy talking about trauma and adverse experiences, but I do want to acknowledge here, and we'll circle back to this at the end, that experience in the middle, right? Like whether or not these 3 E's lead to trauma is heavily influenced not just by adverse experiences, but also positive experiences. So you may be familiar with the term ACEs, adverse childhood or adverse community experiences, but that terminology is really shifting to PACEs, positive and adverse childhood or community experiences. So it's not enough just to think about the adverse experiences, but you also have to think about the positive experiences, because they actually play a really important role, like we just showed with that, the 2 kids example. And so research has shown that regardless of the number of adverse experiences that somebody has, if they have more positive experiences, they will have better health outcomes. And that's really exciting, because as somebody, working in community and working with individuals, you're working with that new mom, you can't do anything about what happened in her past, right? But you can do something about what happens right now. You can perhaps foster some positive experiences, and we'll talk more in our second section about what that looks like. So this is really hopeful, I think. So when we are thinking about adverse experiences, let's define this a little bit. So what do we mean by this? Some of you may be familiar with Dr. Vincent Folletti's work, right, at Kaiser here in San Diego, and that was really kind of the beginning of ACEs research. And most of that is what you see in the tree. That's the household experiences. But really, types of adverse experiences can be much broader than that. So we may see community adverse experiences. In the picture, this is the soil and the roots of the tree. You may also see environmental ones. We had it in COVID-19, right? This is something that's kind of all around and experienced by everyone. But again, this is just the first E, right? So what you're seeing on the screen is the experience. It's not the trauma. Because whether or not this experience is resulting in trauma is dictated by those other E's as well. So some of these adverse experiences you can see may be directly related to food, lack of food security, lack of access to nourishment, but others may just affect your relationship to food. Having substandard wages or lack of jobs may have an effect on the type of food that you're able to buy. And, if you think back to that relationship with food, maybe, that's, another area where you see that tension of, I want to be here, but I'm not able to because of these things. We had a comment here of, because of current financial situations, it's a little bit, you're not quite able to be where you want to be. So in the end, if we're defining trauma, it's important to understand that it is a neurobiological response, right? This is something that is happening inside the body. This is not just all in your head. This is not just like one big bad event. This is a neurobiological response. It is when the nervous system is overwhelmed. There's, you could say, too much, too soon, or too fast to be able to stay regulated. It is when there is unchecked stress that turns into physical and psychological damage. And when this happens, the world feels profoundly unsafe. So coming back to these 5 R's of a trauma-informed approach, what we're doing right now is realizing the impact of adversity and positive experiences, and recognizing the signs of trauma and resilience. So let's think about this a little bit related more specifically to food. So within community and society, we may see this play out as food insecurity. You may see a feast or famine mindset. There may be stigma around food or food choices, fat shaming, cultural oppression. May also see control and manipulation around food. Punishment, right? Even as simple as you have to finish your plate before you get dessert, or oh, you did something wrong, so no dessert for you. Using this food, positioning the food as good or bad, positioning food as reward or punishment. And restrictive diets, many of which are self-imposed, but not all, right? All of this erodes our relationship with food over time. And here we may see stigma, shame, and othering. So in this little comic, you see everyone was in agreement. There was the problem, and the problem was located in me. So we want to respond differently than we have in the past. It's so easy to inadvertently have this stigma and shameful response around food and around individual behavior. So as a society, our messages often place an overemphasis on how individual behavior and responsibility are related to food and health. And so the science of trauma and neurobiology shows that most health and social problems are not because of individuals, but rather they're the result of complex interplay of biology, wiring, and our environment. Many of society's persistence beliefs about and messages about well-being and success have created unnecessary and damaging shame and stigma and othering of people who struggle or suffer. And we already touched on this a little bit if you think about this specifically to breastfeeding. Somebody talked about like this idea that breastfeeding is natural, so it's easy, right? And so what does somebody feel then if they're not able to do it, if they don't have enough milk being produced, or if they're not able to pump at work, and all of these other environmental or biological things that they have no control over. But how do you feel? You feel shame, you feel guilt, you feel like you're letting down this infant, right? And so we really want to explore how we can move away from this messaging. So how does adversity and trauma complicate the quest for health? So sometimes the word trauma is used, like we said, casually to refer to something stressful and painful that happens. But the reality is that difficult or stressful things are also mechanisms for our nervous system to expand its capacity, right? You actually need, it's kind of like a muscle. You need a little bit of stress to be able to build resilience. So when we're talking about our stress response is a good thing. It's kept humans alive for a very long time. We don't want to get rid of stress completely, but we do want to keep the stress at a manageable level. So the three types of stress that we have positive stress. This is a brief increase in heart rate, mild elevations in stress hormones. Maybe this is the stress that Crystal and I feel before making a presentation this morning. And that's keeping us on our toes, right? It's not a bad thing. And then we have tolerable stress. This may be serious but temporary stress, and it's buffered by supportive relationships, right? So perhaps this is a heated argument with a loved one, or maybe this is losing a loved one, but you have support to help you through that hard time. It's not too much, too soon, too fast, because you have support and you're set up to kind of move through that time, right? But then we get into toxic stress. And this may be prolonged activation of the stress response with no protection or relief. So when it does become too much, too soon, too fast, right? And so this is where we see PTSD. So when the toxic stress is actually leaving a neurobiological residue, meaning that the body is continuing to respond to this stress even when it's gone. The body can't get out of this response mode. So what does this look like? So we have, you may be familiar with fight or flight or fawn or freeze, right? So we've got that hyper arousal and the hypo arousal. And so in the middle is what has been coined the window of tolerance. And this is where we want to be. This is where we can respond to life's up and downs. We can be flexible and curious. We can say, okay, I've got to find a way to like feed myself while I'm feeding my baby and, not drop too much food on their head. But I can do it. I can make decisions. I can self-regulate when the baby won't stop crying and I need to take a breath to calm down, right? These skills, being in this window of tolerance, this is where you need to be to handle things that are difficult, which includes feeding a newborn baby. And so here we can see the lightning bolt is a stressful situation, and you kind of go up a little, down a little, but you're still able to stay in this window of tolerance. Somebody who has a toxic stress response may not be able to. So they may have a similar stressful experience, and it skyrockets up to hyperarousal, where they have anger, anxiety, chaotic hypervigilance, hyperactivity, or they may shoot down to hypoarousal, depression, numbness, withdrawal, shame, disconnection, lack of motivation, right? They may get stuck off or stuck on. And in these stages, there's an impact on their body as well. There may be high blood pressure, chronic pain, sleeplessness, digestive and appetite problems. Down at the bottom, you may see chronic fatigue, low blood pressure, again, poor digestion and appetite changes as well. So some of these behaviors and health results that we don't want to see or we want to change, they may be a result of this overactive stress response. And so in your jobs, recognizing these symptoms can help you to better understand how participants' behaviors and outcomes really may be resulting from something that they cannot easily control. And remember that stigma graphic, right? We don't want to create the situation where we're putting this individual blame on somebody, whether, on purpose or not, for something that is outside of their control. So some of you may be familiar with this ACEs pyramid, which has kind of expanded over the years. You might be familiar with an earlier version that doesn't have the bottom two layers. And we already mentioned Dr. Vincent Folletti, which is where this came from. So he was initially studying an obesity treatment and why patients were self-sabotaging after achieving their goals of weight loss and then regaining the weight. So what he concluded was that childhood trauma was actually at the root, and many of his patients were unconsciously seeking safety in being overweight. Sadly, as the result of sexual abuse in these cases. And some were, and so Folletti asked if obesity is a problem, a solution, or both in these scenarios. And so a fuller version of the study found that people with 6 or more ACEs died nearly 20 years earlier on average. And this image is like I mentioned, it's kind of been built out. And so it shows how childhood experiences, adverse community experiences, and even historical and generational trauma lead to that disrupted biology and ultimately to the risky behavior and poor health, illness, and social problems, including addiction. So many times public health comes in at that orange, the adoption of health risk behavior. So if we're coming in and if we're only looking at the pyramid from there up, we're not acknowledging all of what has happened before that is influencing where we're at now. And so the science of how trauma works in the body complicates our traditional understanding of the mechanisms between dietary intake and health. And so we see all of these effects that trauma and toxic stress have on the body, including nervous system, cardiovascular system, immune system, and endocrine system. So I want to circle back because it can be a lot to go through all of the, it's important to kind of level set how do we understand trauma and how do we understand its impact on health and health behaviors. But I do want to remind you that is only half of the picture. It's important to understand, and that's why we spend time on it. But it is also important to understand the positive experiences as well and how important those are. And so for this, I do want to introduce a term that may be new or may not, but the term is salutogenesis. Excuse me. So salutogenesis is using and growing our assets, and it's asking the question of what is needed to be well. How can we heal? How can I support health and wellness? As opposed to pathogenesis, which is looking at what is wrong. It's more deficit or problem focused, and it's defining health as the absence of disease, as opposed to defining health as increasing resilience of difficulties, and defining health as the ability to flourish and to live in a way that is enjoyable. So when we look at some, salutogenesis and think about what questions we may ask ourselves or those that we work with. A salutogenesis approach may ask, how has what happened to you impacted your ability to be well, build meaningful relationships, and live the life you want to live? And if we're looking at this in relation to nourishment, we may ask, how has what happened to you impacted your ability to manage your food resources, navigate the food environment, and effectively nourish yourselves and others? So the answers to these questions, there may be some challenges and some things that have happened that are making it difficult, but there also may be some things that are positive. And it's important for us to realize and recognize the assets that somebody has in their life and the support and the things that they're able to do well already. So we've been going for quite a while. So we're going to take a 5-minute stretch break, refill your water, your coffee, use the restroom. So we are actually right at 10:15. So we are going to start up again at 10:20. And for the remainder of the time, we're going to be taking what we just discussed and applying it more directly to women and mothers or parents. Okay, we are back at 10:20. So I am going to hand the mic over to Crystal. He's gonna re-regulate us because it's something we need. You don't just stay up in this reasoning state forever. So we're gonna take a moment to re-regulate, and then she's gonna go back into the content.
Thanks, Carrie. Can you see that? Okay.
Yes.
Oh, great. Okay, so as Carrie mentioned, we are going to do a little regulation activity. We are big on grounding activity, kind of looking at the neurosequential model of our brain, which we'll talk more about next time, but that may be a familiar term for y'all. So we're going to do this activity called STOP, which is actually one of my favorites. So the first thing you're going to do is notice yourself sitting or standing. So really take a moment to feel yourself in this position. Feel your feet on the ground. Now take a breath. Feel the air going in through your nose and exhale out of your mouth. Next, observe your surroundings. What do you see? What noises do you hear? And last, really feel your presence in the room. Take up some space. Take time to think about where you are in relation to other objects in your room. maybe other people if you're sitting at a desk with folks around you. Okay, so now we're going to go forward. We will talk more about breathing and grounding activities during next time and kind of the importance of that and self-regulation and then connection with other people. So as Carrie alluded, we're going to kind of take some of that information that she talked about and we're going to apply it to pregnancy, childbirth, and the postpartum period. And then also look at some ways that ACEs specifically can impact breastfeeding or chest feeding. So we have another Mentimeter activity. It's the same code and the same link. So if you have that up, you can just go back to it, whether it's on your phone or the computer. Thanks, Jackie, for dropping that in the in the chat for us. Appreciate it. And so the question is, what are some factors that impact a person's ability to breastfeed? And that factors is kind of vague, right? So it can be whatever you have experienced yourself, or I know a friend has experienced, or any kind of factor that can really impact or influence a person's ability to breastfeed or chest feed. So let me get back to Mentimeter. I'm getting over a cold, and Carrie, it sounds like you have one. So we're okay. So some things that have come in: their birth experience, prior surgery, if their friends and family breastfed, early support from medical partners, friends, family, societal norms, work schedule, other children in the family, the baby isn't latching well, any issues with the baby, maybe illnesses or things like that. My granddaughter was born and she had she wasn't able, basically she was aspirating, so fluid was going into her lungs, and so she had to have surgery at a young age, and so that prevented my stepdaughter from being able to breastfeed, and she was really upset about that. Lack of supportive partner, their metabolic health, a past experience with breastfeeding, if they've experienced sexual abuse, and yeah, we'll talk more about that specifically with ACEs, healthcare system barriers, social determinants of health, absolutely. Our environment and systems so much shape what we can do. If the baby in NICU or has a tongue lip tie, yeah, Carrie, I hear, was that you going,
Yeah, not in NICU, luckily, but but the lip tie or the tongue tie. Yeah, I was at a conference once and it was, a public health conference, and this was during the formula shortages, so a couple years ago. And there was a panel that included some USDA folks, and it was, not the primary point of the panel, but it came up during the discussion, and somebody, they had time for questions, and somebody came up and did this whole soapbox saying how the formula shortages shouldn't be a problem, and why are we even concerned about that? Because we should just be everyone should breastfeed, and we should only be promoting breastfeeding, and there should be no talk about formula whatsoever, and why is this even a problem? And then got like this huge round of applause, and I was just like, wow. Like, how blind is that to everything you all are saying right now on the screen, and just not grounded in reality at all, and such a shameful response, or a shaming response, I thought. So there's so many factors that impact this.
Yeah, thanks, Carrie. Okay, so along these lines, we have a video we're going to show just a clip of. So let me. Hopefully you'll be able to hear this. Carrie, let me know if something happens. Because Zoom seems to be doing interesting things today on a on a Tuesday, Monday, I'll say. So let's see.
When I delivered my first baby, a lactation consultant saw me each day. That made me feel really empowered. During my second delivery at a different hospital, I had to fill out a form to request a visit. None of the nurses offered me breastfeeding help. The way I felt at discharge with my first baby was very different than how I felt after my second baby.
Initially, it was not possible to manage work and breastfeeding. I have taken 6 months leave so that breastfeeding could be done in a proper way.
La verdad es que tuve que dejar mi trabajo porque no puedo darle mamar y estar trabajando a la vez.
Maternity leave is absolutely crucial for breastfeeding.
Ce qui m'a véritablement aidée pour réussir cet allaitement, c'est le fait d'avoir eu la chance de pouvoir prendre un congé parental de 6 mois.
Essa história é muito bem sucedida. 2 técnicas de enfermagem que souberam lidar com o problema.
There was only one person available to help maybe 60 women at one time with breastfeeding.
Our healthcare providers were there to offer help and encouragement.
The doctor prescribed formula. I had strong intention of breastfeeding my baby.
Recebemos sim o suporte adequado da equipe de enfermagem, né? Eu sou muito feliz e muito grata por uma experiência privilegiada.
En el centro donde di a luz no me prestaron ese apoyo.
Okay, so
when I delivered my first baby,
that always happens. Always. I don't know how to make it stop. Anyway, so kind of the point of that Mentimeter activity and sharing, and then this video is to say that, you know, even people who don't necessarily have trauma or have experienced adversity or ACEs have challenges and barriers that exist. So now we're going to kind of shift and think about, that, and then we're going to layer it with some, adversity, and talk about common adverse experiences for women and people who give birth. So first we have violence. Women and transgender or non-binary individuals are more likely than men to experience some type of physical violence in their lives. So, for example, data from the Centers for Disease Control and Prevention's National Intimate Partner and Sexual Violence Survey indicate that about 41% of women, compared to 26% of men, have experienced contact sexual violence, physical violence, and or stalking by an intimate partner, and reported an intimate partner violence-related impact during their lifetime. Injury, post-traumatic stress disorder, or PTSD symptoms, as Carrie talked about earlier, concern for safety, fear, needing help from law enforcement, and missing at least one day of work are also common impacts that were reported on this survey. Next, unwanted sexualization. Women and transgender or non-binary individuals are more likely to encounter unwanted sexualization. So this could be through objectification in the media, microaggressions in everyday encounters, just conversations, macroaggressions like harassment. Also media. Women are more likely than men to be shown wearing revealing clothes or simulating sex acts, being dominated or portrayed as objects and even animals. And then we have societal messaging. Women's bodies are often digitally altered to remove blemishes, to lengthen legs, to reduce waist and hip size, but at the same time to increase bust size. So we're inundated with this ideal body type that we can really never live up to. And then we have this concept of an ideal partner. So we're supposed to work, cook, clean, be a mother, be a caregiver, all the things. So because of these things, women and transgender or non-binary individuals often carry a fear of violence. And these experiences can erode a person's sense of safety in the world. And many times, these are some of the things that women bring with them into pregnancy and beyond. Our bodies are politicized. We know that. So during pregnancy and childbirth, this experience itself can come with some adversity without any other things going on. So vulnerability, which can cause feelings of anxiousness, unfamiliar experience or experiences that can be happening. There's always some fear or apprehension with things that are associated with the unknown in general. And concerns associated with one's body. So it can be pain, insecurity, living up to that ideal I just mentioned, concerns about attractiveness, what's happening physically to one's body, and not to mention that childbirth itself can be really scary and painful. So during the postpartum period, there can be tensions between the different functions of the body. There can also be elevated stress during this time. Some people may feel like everything is on the line when it comes to breastfeeding, and they can't really make a compromise. It's kind of an all or nothing mentality. Mothers and primary caregivers hold the burden about the success of their child, and they can feel that. So there's quite a bit of research concerning the general pressure or stress associated with breastfeeding. Most of that research has focused specifically on women, experiences of women, and uses the term breastfeeding over chest feeding or body feeding. So research shows that the pressure to breastfeed comes from two main sources. One is healthcare providers, and the second is media and society. Women reported that the pressure to breastfeed is associated with judging themselves against an ideal. So there's not a lot of latitude given in the messaging oftentimes about breastfeeding. We hear the term breast is best is a common phrase. So that judgment is associated with body dissatisfaction and eating disorders. Additionally, research shows that breastfeeding difficulties are associated with anxiety, guilt, shame, embarrassment, depression, and obsessive compulsive behavior. Grief and loss of not being able to breastfeed can be associated with trauma in and of itself because of feelings of shame and humiliation. Oh, sorry about that. That's what that was. So women also reported not receiving sufficient support about difficulties, and they felt judged for considering alternatives to breastfeeding, for example, pumping or a combination of bottle and breastfed. Also, lack of culturally sensitive supports. So this can be mental health and dealing with that in a culturally sensitive way. Representation and visibility of lactation professionals of color, and community-based lactation resources, so support groups or classes that, and part of that and what the research shows is that people also wanted that integrated with reproductive justice and trauma-informed care. And then women also reported structural and systemic barriers to breastfeeding, like was mentioned in the Menti and then that video. So like paid parental leave and having public facilities available for women to do that. So now let's just look specifically at ACEs, so adverse childhood experiences, and the impact that that has on breastfeeding. So most of this information comes from a scoping review of current literature on breastfeeding and childhood maltreatment. Research shows that individuals with any type of child maltreatment had lower rates of exclusive breastfeeding than non-abused counterparts. Individuals who experienced multiple types of childhood maltreatment were also more likely to terminate breastfeeding earlier. Child maltreatment was associated with feelings of distrust stemming from distrust or betrayal of an authority figure in childhood that then carried into adulthood. So this feeling of distrust prevented individuals from speaking up and asking questions. So they just didn't feel comfortable with the person providing support, their medical staff or whatever, because they just had this innate sense of distrust for anybody in an authority role. Individuals with a history of childhood sexual abuse experienced even more challenges in the early breastfeeding period and were more likely to report pain and mastitis than individuals with no history of childhood sexual abuse. Individuals reporting high stress postpartum period and a history of childhood sexual abuse were 91% less likely to breastfeed exclusively compared to individuals who didn't have either of those things. So 91% less likely to breastfeed exclusively. Individuals with postpartum depression and a history of childhood sexual abuse were 95% less likely to exclusively breastfeed. So clearly, childhood sexual abuse adversely affects a person's ability to exclusively breastfeed, regardless of these other things that are going on. Research showed that breastfeeding triggered memories of abuse. So the physical touch by providers and children that was related to breastfeeding was difficult for participants. It really reminded them of the abuse, and it triggered shame. One woman said, and this is a quote, "It always amazed me as to how beautiful an experience it could be, and yet for me, it was such a trauma. I was so ashamed of my body," end quote. Significantly, provider touch was especially difficult. Participants reported being surprised by the intensity of a clinician's touch in the hospital, and some found it to be abusive. Individuals reported that people just kind of coming in and helping themselves to people's bodies, just like grabbing them with no kind of warning about what was going to happen, no instructions, no like, this is coming your way. They really felt unprepared and unaware. And they were also uncomfortable with healthcare staff just coming into rooms without knocking. Overall, they just felt unsafe. So this section on adversity and trauma during pregnancy, childbirth, and the postpartum period provided some important research that we'll share with y'all in a follow-up resource, and background information for why a trauma-informed approach and universal precautions that we mentioned earlier are so important for lactation care and supporting new moms and people who have given birth. So between today and our next session, we have some questions we want y'all to kind of reflect on. Whoops. So what do we do to reduce stigma, shame, confusion, and tension? Leverage strengths in order to promote confidence, dignity, and joy. and inspire a healing and healthy relationship with oneself and with one's body. Being trauma-informed is about helping people find what's within them and their communities that can help them heal and engage with the world with a sense of agency and autonomy. So think about how you can support this and what your role is in your particular job that you do. So we're going to end, well, it's not quite the end, but I'm going to end my section with emphasizing that trauma-informed care is a strengths-based approach, even though we spent so much time talking about adversity today. We're always looking for resilience and way to cultivate positive experiences and promote protection and healing. So next time, we're going to talk more about strong families and communities, rich cultural traditions, how these things are important, and then self-healing practices. And these are kind of the three buckets that protective factors get lumped into. So we'll talk more about them next time. And let's see. Am I turning it back over to you, Carrie?
Yeah. And you can see the 5 R's now. Yeah. Okay. Whoops. Okay.
There you go.
Okay. So just to summarize what we did today, and as Crystal was saying, what we will do next time. So we like to come back to this framework, these 5 R's, as our kind of guideposts as we work through this information. So what we hope we've achieved today is largely the realize and recognize portions of this framework. Now, I think that there's a fair nod to the resist as well. Resist re-traumatizing, be prepared to repair. Some of the information that Crystal shared will hopefully enable kind of perhaps a wider understanding of what may be re-traumatizing that perhaps we hadn't thought about before. And then resilience as well, kind of that's the 5th R that we added in from Samsa's model. So it kind of gets sprinkled in throughout the conversation, but this important role of resilience and how resilience and positive experiences can buffer the effects of trauma and adversity. So next session, as mentioned, we'll spend more time in that response. So one more time, we'll go and finish on Mentimeter. Crystal, if you can drop that link in. It is the same link that you used before if you still have it opened. There we go. So to finish our time together today, just asking first, what surprised you or perhaps stood out to you? Maybe a reminder. Maybe it's not something that was surprising or new, but something that stood out to you about today's section. Like we said, we did realize and recognize, right? So were there things that perhaps you didn't realize or recognize before or hadn't thought of in quite the same way? Give you a moment to type in. And as mentioned, if you want to come off mute, please feel free. We've got a small group, so feel free to share in that way as well. And if anyone is having trouble getting back into Menti, you can also drop your comment in the chat and we can read that out loud. So somebody mentioned the ACE's impact on breastfeeding. Can you share the resources for this? Absolutely. Yeah, we'll share all of the studies and research that that were used throughout this presentation. The use of grounding, excuse me, activities during the presentation stood out to you. Good. I hope that helped you to be able to connect with the information a little bit. Liked how you all set the table for the first half hour about food and our bodies and how we think about these. Yes, absolutely. The depth of understanding of trauma and all of its ramifications. Great. All good points to take home with you. Done other trauma-informed trainings, but hadn't seen the positive impacts wrapped into PACEs. Yeah, one of the resources that we'll share is the believe the website is just pacesconnection.org. We'll share it with you, but yeah, it really changes the conversation, I think, as somebody who's in the the space that you all are, because it can be, without that positive side of it, it can be very frustrating to learn this information, right? Because you say, oh, great, the cards are stacked against us all. It's depressing. You feel as though there's nothing that you can do to help, right? And it's just not grounded in the research. That there's like this whole other side of the equation. So it's really important to, yeah, it brings in some more hope into the conversation. Otherwise, it's very doom and gloom, and people leave the the training or the conversation just feeling as though what they do doesn't matter. And that's really not the case. So it's an important part of the conversation. Like the reminder that the trauma approach helps everyone. Yeah. And that's such a, when we first started doing this work, we didn't have that section differentiating trauma specific services and a trauma informed approach. And we got pushback saying, I'm not a therapist. I am not qualified to do this work, and that's not what we're asking for at all. And people feeling as though like, okay, should I do like an ACEs screener then before I have a conversation with them about food, or hand them a food bag, or whatever the work was that they're doing. And some of you may, right? I do an ACEs screener when I go to the doctor. So some of you may be, like Crystal said, you may be more in this trauma specific services, but a trauma informed approach is that universal approach. It's that curb cut, that it's good for everyone. And I think the language can just be a little heavy, and frankly a little uninviting, right? It feels as though you need to have this like special certificate and all of this training in order to take a trauma informed approach. But really what we're asking for is that you approach folks with compassion and understanding. And that can be enough to start you on your journey of that trauma informed approach, right? Because remember, it's not a checklist. Opened your eyes to be aware and compassionate and to ask questions, right? So to see that there's, what you'll probably see in our next session, this iceberg, and maybe you've seen the iceberg image before of like at the top of the iceberg is you see the reaction to a situation, but below the iceberg is everything else that you don't see that's informing that person's behavior and their reaction. And so the more that we can ask questions and be curious and kind of expand our understanding of what might be below the surface for somebody, the better of a reaction we can give to them, and the more connected we may be able to be with them. Jackie said it can be as simple as the reminder that you don't know what someone else is going through or has gone through. Absolutely. We heard so many stories, so many differences just in this small group, right? So finally, and some of you kind of already got to this with the last question, but how will what you learned today affect how you approach this topic? And like I said at the beginning, you may end today with more questions than answers. And this really takes some time to kind of sink in. So maybe you don't know exactly how it's going to affect how you approach the topic. We haven't even gotten to the point where we say like, okay, here are some techniques and strategies, right? So right now we're still kind of in your head at that point of realizing and recognizing and kind of seeing things a little bit differently before we even come to our response. But for what you have so far, how might this affect how you think about the topic of breastfeeding, let alone how you engage others in that topic? I know for me, when we first did this session and Crystal, did a lot of the research for her section, and I had never really considered the term breastfeeding versus chest feeding versus body feeding. And I've had, and you've probably noticed, I struggle a little bit with the terminology, but it really did open my eye. It's something I had never considered before of even the language that I use around that and how gendered that language can be. So that's something that I try to do a little bit differently when I approach the topic, is just even taking into consideration the language that I use around it. All right, someone shared, I feel more equipped to advocate for people and help provide better understanding of why trauma-informed care is important in every aspect of postpartum care. Yeah. Yeah, we're talking about a very, very, specific part of postpartum care. And it's a part that affects other things, right? You think so little, at least for me, I felt as though postpartum care didn't really talk about the care for me, right? You have like a six-week follow-up and they're kind of like, how you doing? Yeah, you're good. Okay, see you later. So much of the postpartum care is, I felt, on the child, right? So we're not even broaching, there's this whole topic of postpartum care for the mom and thinking about how she is able to take care of herself and nourish herself before she's even able, or before they're even able to nourish the child. Helpful for us at COI to think about, to make sure that we are using a trauma-informed lens when communicating with partners, the public, etc. Yeah. Okay, well, as you, feel free, I'll leave the Mentimeter open here for any final responses. I know it takes some time to gather your thoughts and to type it in. But I'll also open, we've got final about 6 minutes. If there's any questions, already have the questions about the resources, we will be sharing those. So any final questions, or at some point, Jackie, if you have final announcements as well, give you time for that.
Yes. Sorry, I have two different computers going right now, one for recording and one for me listening and being able to participate in chat. I just want to make sure you all signed into our session 1. I know I got a chat from a couple of people who had to hop off early. They were interested to know if there would be a recording, and there will be a recording. We're going to get that up on our website. Hopefully, Mary Beth, our tri-chair for this domain, will get it up on Rady's intranet also to make it more accessible to providers. So that will be in the works, and we will keep you updated with emails. We'll also send you an updated or a follow-up email with some notes and summary to Carrie and Crystal. If you guys are open to providing your slides for session 1 as a PDF, we can go ahead. Thank you very much. We can go ahead and distribute those in the follow-up email as well. And just a reminder, session 2 will be on December 4th, which is a Wednesday, and 9 to 11 as well. And you'll get plenty of reminders. And that's all I had.
Jackie, we'll send the slides along with the resource list this
perfect.
afternoon. I'll send both to you.
Yes, wonderful. And that's it for me. So just make sure you guys sign into that sheet in the Zoom, and feel free to hop off. I will stay on for a couple more minutes, and just if anyone has any questions or anything that they need, and make sure they can like get the links, or if they want to scroll up and look at the chat, I'll stay on for a few more minutes. Thank you very much, Crystal and Carrie.
Thank you all. Thank you for your active engagement. Always makes it better.
Thanks, y'all.
I can stop the recording now, though.
Let us know, Jackie, what registration looks like as we get closer to December. We'll, since they're so far apart, and kind of